Shall we introduce what the hell it is we're doing here?
It'd probably be useful for people. Yeah.
Probably good, wouldn't it?
Yeah. Go on, you go first. Go on.
Shall I do it?
Yeah.
We're the Mental Stealth podcast, and we're using this as an opportunity to sort of, share stories of our experiences with anxiety and what we believe and what we know to be the ultimate method of dealing with anxiety and all of the various experiences that we've had getting to the point where, where you founded the method and obviously recovered yourself, and where I then found the method 5 or so years ago and recovered. And we're trying to sort of put some stories forward to make people realize, that recovery is completely inevitable and possible.
Yeah. And that they're not alone. And it's really strange.
Yeah.
When we're sat here side by side, we look like the before and after of years of stress.
Yeah.
Yeah. You're much prettier than me, but, Anyway, this is what... I did have hair and, and good eyesight at one point.
Really?
Yeah, apparently. It's a long time ago. I've forgotten it. But, yeah, I mean, you're absolutely right. I mean, the reason we decided to do this for all of those people listening to us, and we hope it is a lot of people.
Yes.
I've got 30 years of this behind me. I had 22 years of suffering and then 30 years of helping people. So a total of 52 of my 58 years have been spent either dealing with anxiety or helping people that suffer with anxiety. I feel very passionate about doing this. When I met, just for the people listening, when I met Sam and we did one of our weekly webinars together for clients, and it worked so well and people loved it so much, we thought we better put a podcast together.
Totally, yeah. That was it was lovely to do that. It was lovely, and I think those weekly webinars are brilliant because it is an opportunity to actually engage with clients who are using the method and who are dealing with anxiety, and it's a great way of sort of actually connecting with them, and it's a lovely community that's been built, I think, which is great.
Yeah. No, it is. It always has been. I mean, we've had a great group of clients. I mean, many, helped, I think, just over 650,000 people since 1996. So it's a lot of people, but they're all good people. We're all of like mind, so to speak, and that's why I thought we'd take this opportunity to put this podcast together, because people need to know about this. They need to understand who we are and what we do and how we work together to create recovery, true recovery. Absolutely. There's so much bullshit out there, so much misinformation around anxiety, and even listing it as a mental health issue. We can go into this, at some time in the future, but, the fact that it's been monopolised by mental health services is in itself so bloody flawed, and that's the foundation for everything that doesn't work, and it's disgusting,
Yes.
And I come under attack for saying these things, but ultimately it's the scientific truth. People just need to listen and understand, because they feel guilty. They think they failed, and that's the problem, Sam.
Oh, I mean, I think, and obviously we're going to talk more about this in this episode, but we've both got I think quite shocking stories of experiences with other forms of therapy, and it's unbelievable. It's really quite breathtaking. But the problem, I think, the problem with it at the time, you do believe that you're doing the best thing for yourself, don't you? You go to these therapy sessions thinking, right, I'm really doing something, and I'm thank God I'm actually doing something, and of course you don't realize that in many cases you're not helping yourself in any way at all. And you're being told well, I mean, let's dive straight in with that. I when I went for CBT, I was put onto CBT with the NHS, and the first session that I had with this therapist who had been prescribed to me, he said to me, right, I want you to come up with a list of 5 goals as to what you want to get out of these sessions. And I've told you, I said, even then I thought to myself, that seems strange. Why do I need 5? I've got one goal, and that's to get rid of anxiety. I don't really have anything else. But I guess I conjured up some arbitrary list, but number one was obviously get rid of anxiety. And I think before I even finished the word anxiety, he said to me, "That's not possible. You know, this is who you are now. You will always be anxious." Yeah. And he even said to me, "You'll have to be on medic," because at the time I was on sertraline and zopiclone, which is, antidepressant and a very heavy sleeping pill, because I was suffering insomnia. And he said to me, not only will you be on those for the rest of your life to manage your anxiety, but you'll be in therapy for the rest of your life to deal with and come up with coping mechanisms. And, to say that to someone who was really, right in the pit of anxiety, I mean, I just think that's horrendous. And, luckily, I'm very lucky, something in the back of my head when he said that yelled bullshit. And I acknowledge that I'm very lucky that I had that, because I know for so many people, and I've spoken to so many people who have had a similar experience, and for them, it completely just, it was like someone floored them, like someone putting a boot on the back of their head.
Yeah, yeah.
And and it can be detrimental, but luckily for me, it was like that's not true. That can't be true.
How old were you then? What age were you when you were told that?
Well, I'm 31 now. And that was probably about, I'm going to say 6 years ago.
Okay, so you were probably
about 24, 25.
Yeah, when I was 26, I had the exact same conversation with a psychiatrist. And it was only the second time I'd been to a psychiatrist. I was 26. My dad took me because I was so agoraphobic. And I had the exact same conversation. Now, bear in mind, that was I'm now 58, so we're talking, 42 years ago.
Yeah.
The same conversation 42 years ago. And it was identical. You will never recover. In fact, I happened to be able to get, after this session with this psychiatrist, which was at the local hospital, in what they call D wing, which was the mental health wing. Dad sat outside, I went in, and when I was in there, he was referring to notes. And now these notes clearly were paper notes back then, and they'd come from my GP and probably contained everything that anybody from the NHS had ever sent. Bearing in mind, I hadn't really relied that heavily on the NHS. Most of the stuff I'd done, I'd paid for myself or through insurance. So this was something new to me, to go and see a psychiatrist for the second time. And he told me the exact same thing as you. And he said, and afterwards, the point I was getting to is I retrieved those notes from my GP. I actually managed to get them. And I read them, and it was disgusting. He called me a heart sink patient, which means that your heart sinks when they walk into your office.
Yes.
They called me a frequent flyer. They said that I looked like I'd been sleeping rough. I mean, I've still got these. I can hunt them down. They said that I looked, unclean, like my personal hygiene was off, which just wasn't the case, Was it perfect? No. A lad at 26 with anxiety. I'm not going to be showering twice a day, but I certainly wasn't dirty. My hair was long. I was overweight, yes, but my clothes were clean. It wasn't representative of what I was. And it just disgusts me, because I've heard this story, tens of thousands of times over the last 30 years. And it disgusts me that people, they spend 40 minutes being paid £300 to assess you in that way. And you walk out no better off than when you walked in. And the only advice he gave me, Sam, and I'll tell you, everybody this, because it was disgusting. My dad, I don't know how I don't know how to restrain my dad. His advice at the end of this session, his only advice was this, and this is genuine. He said, on the way home, he said, "Are you on your own?" I said, "No, I'm with my dad." He said, "Well, get your dad to pull over outside a paper shop and go inside." And he said, and get a few magazines from the top shelf. And he said, and go home and masturbate yourself happy. That's exactly what he said to me. And I mean, even to this day, I think, what kind of a man would say that? This is meant to be a highly qualified mental health professional, and he had no clue what he was saying. And it was almost like he was taking pleasure out of my suffering, But that's exactly what he said to me. And I came out crying, and my dad said, and I told him what had been said. And he said, right, And I said, no, let's just go home. Let's go home.
Yeah.
But that's honestly what he said to me. And I was 26.
That's unbelievable.
And what's even more unbelievable, he thought that happiness was the opposite to anxiety.
That's it. The other thing, isn't it?
Happiness has never been the opposite of fear. And that this is the way they think. It's mind blowing. But anyway, That's a different story. But
Wow.
it is incredible that our story, all those years apart, we have the same experience with the same professional, really.
Yeah, well, totally. And I think it, like I said, I was very, very fortunate that there was just something in me. And I think this kind of leads into the method, isn't it? It's we all know what we actually need to do to recover. We just need someone to guide us and push us towards what that is, and that's what makes it so amazing. And I think that's probably what they thrive on, isn't it? Because if they can make it seem more complicated than it is to recover, that seems like it's more sellable. Oh no, it can't be that simple, because no one ever believes that anything can be that simple, because life nothing's that simple or easy in life. But actually in this case it really is. And I think all of these different therapies come along, and tapping and hypnosis and all of that stuff, and it's overcomplicated, and it's just piling. It's piling layers on top of what is actually a very simple thing,
but there's a reason for that,
just to make it more sellable.
Well, the thing is, though, the science is simple. So if you have a condition that has been cornered by a particular industry, let's call it, which is psychology and psychiatry, the mental health industry, if 90% of those conditions are anxiety-related conditions, and you can get rid of them quickly, then it's no longer financially viable as a business model. It collapses. So they have to maintain. We did trials for the NHS. I won't say which PCT it was, but it was about 16 years ago. And with this trial concluded that we provided the most effective treatment for anxiety. So they threw us out. They actually said in the meeting, it was a German guy, and he was a nice guy, and he had good intention. And he said, look, in Germany we have a policy of trying to cure people, but for the benefit of this, we can't do that, because we have in the NHS we have a policy of maintenance, and my psychologist that was working with us at the time said, maintenance of what? He said, well, maintenance of the client base. So ill health then? Yeah. Well, so what you do is you give them enough to feel that they're benefiting slightly and that they keep coming back until there is no more, but you don't cure them, because if you cure them, they never come back. And finding new clients, it's a marketing thing. What you need to do is upsell all the time. So if you start with CBT, that doesn't work. You move on to NLP, EFT, EMDR. You try a bit of hypnosis. You might try a bit of tree hugging, or I don't know, dancing around naked in the forest at night,
or masturbating.
Or masturbating, of course. Which this is the point I'm trying to make. It goes from the sublime to the ridiculous, just to keep you captive, and none of it works. But I was told that as an NHS patient, I'd made the NHS around £300,000 with the treatments that I received. And what's what's comical about this, Sam, is that I have people say, well, why do you charge for it? I get what you do free on the NHS. Well, no, you don't, first of all. But secondly, it isn't free what you're getting. Somebody's paying for it. It might not be you paying for it, but it's the taxpayers that are paying for it. And this £110 billion a year that mental health services suck out of the economy, where's it all going? Well, 90% of it's going to something that can be cured. It's farcical.
And actually, Charles, when I was doing it, I was only offered 6 sessions for free with the NHS. And if their model is, well, you're going to have to keep doing this for the rest of your life, well, you're going to have to start paying for it then, aren't you, after those 6 sessions? So actually, right. you do end up paying for it. And actually, again, this medication that you're going to have to be on for the rest of your life, well, you're paying for that, and that ain't cheap.
No,
so actually, right. you're very much paying for it.
Totally.
And you're putting your money into something that actually is never going to give you what you want.
No.
So that sounds right. Sounds like a waste of money to me.
Oh, totally. And the thing with CBT is that it's cognitive based therapy. I'll go into this in more detail at a later date, because I don't want to get too entrenched in the science of it all. But needless to say, it doesn't work, and the reason it doesn't work is because it doesn't have an evidence base, despite being called evidence based practice. It's called the gold standard of psychological practice. It's not the gold standard, unless what you mean by gold standard is the most profitable, and then yes, it potentially is the gold standard. It's the pot of gold that they use to bait you in. But again, the point is, at the end of it, if it hasn't worked, it doesn't matter, because you still go into a cured statistic because you've been through it, and that's where they get the statistics from. It's about attendance and attrition. If you fall out at the end and you don't come back, then you must be cured. It's crazy.
It's unbelievable, isn't it?
It is unbelievable.
It's absolutely unbelievable.
And I tried to. Sorry, I was going to say. I tried to get the evidence base for CBT once. I mean, it was impossible. I said, well, if it's evidence-based practice, what's the evidence? And
Show me the evidence.
Yeah. They couldn't tell me. Nobody could find it until eventually somebody came back to me weeks later with a tail between their legs, saying, I found it, but you're not going to believe it. And it isn't evidence of recovery, that's for sure. So
I think we've talked about this, that it's and I think as people we put our faith in the NHS, and we put our faith in doctors, and we put our faith in professionals, and we think, well, why would they ever want to do anything other than help us and do things to the benefit of us? But actually, when you start to dig deep, and obviously I know you have, and I've I have started doing that as well, but you realise actually, sadly, it is a system that isn't to our isn't completely to our benefit at all. And that's when you realise, oh my God, actually it's an entire industry built on, like you said, keeping people in a unwell, well enough to sort of go, look, we've done something, but knowing that it's never going to get to the point that people actually want to be at.
Yeah, totally right. Yeah, it's like being farmed. It's like being fattened up for Christmas. It's unbelievable. My mum was a career NHS employee, if you like. She started as an SRN in the late 60s when I was born, and then went through as a nurse, as a sister, then went through into family health and family planning, eventually became one of the first county coordinators for HIV and AIDS in the 80s, and then became a control of infection coach, coaching people throughout the NHS for control of infection. So she was a career NHS worker, and we have discussions about this, and it's sad. She gets very sad about what happened, because when she was nursing was about having good intention and being professional. And in fact, you couldn't not be, because the sister was always there to give you a good hiding if you stepped out of line. So you had to be a professional. But now, I mean, my father's been in hospital just recently with severe infections, one of which he caught in hospital and it nearly got him, unfortunately. But he's on the mend. But Mum sort of is almost sort of head in hands about it. She says, I just don't know what's happened to healthcare in the UK. It's disgusting. But it is all about bums on seats. And then when you become less profitable, when you're too old to be a long-term cash cow, then you're swiftly dispatched by one system or another. And I think it is like being farmed. It's hateful, but it is what it is. And when you're in a fragile state, when you've got anxiety, it's the last thing you want, of course.
Well, that's it, isn't it? I think that's it, and I think they know that as well. They know that they're dealing with people who are people who are very easily swayed towards something. I think because the amount of times we see in films and in popular culture how therapy is kind of it's the chaise lounge and everybody. So we're all familiar with that process and with that concept. And so when we go into it, we're going into it with a sense of, well, this is what you do when your head's not working properly. You go and speak to a therapist. So I think they don't have to do any marketing. It's there for free. It's
that, and there's the protection mechanism around them. Their professional protection mechanism, their insurances, the professional bodies, and then on top of that, if you work in psychology or psychiatry, you've got this thing called professional privilege, which means that you are protected from anything you say within your professional actions. You're protected. You're protected in law, so you can do and say anything pretty much. It's all set up to benefit one person and one person only, and that's the person doing the therapy, and it's a bit of a joke. I mean, like you said, CBT and cognitive behavioural therapy became the gold standard of psychiatric and psychological treatment methodologies. But you can do a CBT certificate through Voucher for 17 quid. So how professional is this thing, CBT? It's a joke. The same with things like NLP, tapping. Tapping was invented by some people that sold books through Hay House in America, and I'll say very little about that, but could you really imagine that tapping yourself anywhere for any amount of time with as much vigour as you wish would give rise to deep changes in the mechanisms that control fear, which is an endocrine response, or it's resetting your emotions? I mean, it's ludicrous. When you actually dig down to the psychophysiology, and this is true of every therapy, whether it was behavioural therapy, whether it was, exposure therapy, whether it was Freudian therapy right at the start of this, none of it has a scientific basis when discussing anxiety, because anxiety is disordered fear. Fear and anxiety are entirely different things. Same mechanism, but one's disordered and one's not. And what the fatal mistake that's been made from the start is that fear is an emotion. It's not an emotion, and it can't be treated emotionally. Or as an emotion, and it's ludicrous. But people, like you say, like us, well-meaning good people that are in a state of anxious arousal, who are looking for safety, will literally latch onto anything that sounds vaguely hopeful, and they play on this, and they grasp you and hold you and keep you close till they've wrung you out. And then when they've wrung you out, they say you're therapy resistant, or you don't qualify for any more sessions, or you've got to learn to cope or live with it, or let's try something different. And this cycle just goes round and round and round and round, sometimes for lifetimes, and it's disgraceful. It really is.
It's horrendous. Another thing I guess this is what this is what we wanted to do on this podcast, and it's sort of share stories and experiences. One of the things that that therapist said to me in another session, and this was actually more terrifying for some reason. This was more terrifying to me than him saying this will always be you. You'll always have this. I can't remember what exactly the point he was trying to make and how it came about, but I remember him saying to me, most boastfully, he said, "Oh, by the way, at any point, I could." We could induce a panic attack. I could put you into a panic attack. And I remember being like, please don't do that, because that was, him saying that sent that horrendous shiver down the spine and guess what? It activated anxiety.
Oh, God.
Because it was like, I guess he was trying to make the point that, if I can activate it like that, then I can deactivate it like that. And it's, but just saying something like that to someone, like it's mind-boggling to me. It's absolutely mind-boggling. And another thing with it, I remember with that therapy, once a week. So I remember I had my sessions every week on a Sunday morning, and it was during COVID. So it was all on Zoom, and I remember sort of halfway through the week on a Wednesday or something like that, I'd be sent a digital, questionnaire, and it would be a sort of a check-in, sort of a midweek check-in before my next session, and it would be things like, how often have you thought about being anxious this week, and rate your anxiety this week, and do you feel hopeful for the future, and how many times have you thought, if you have, how many times have you thought about hurting or ending your life? All of these things. And I could have been having actually a pretty good week and feeling pretty good, and then all of a sudden that email arrives in my inbox, and all of a sudden it's like oh yeah, no, I'm anxious. Oh yeah, I'm an anxious person. God, I almost forgot. Thanks for reminding me. And I remember there was one week I forgot to fill it out, or I just, in defiance, I was like, I'm not filling that bloody sheet out. And I showed up to my Sunday session, and he said to me, Sam, you haven't filled out the sheet. And I went, oh no, sorry, I didn't know it would be that much of it. And he went, no, we need to fill it out right now. And I was like, oh, okay. And he said, right, we're going to do all of these ratings. And he was like, how would you rate your anxiety level right now? And I said, pretty bloody high. Probably, I sort of, 8 or a 9. And he said, no.
Fine before, but not now.
Yeah. And he said, generally speaking, how is your anxiety? How do you, and this is probably, I think we'd been doing four of the 6 sessions, or maybe this might have been the 5th session. And I remember him saying to me, rate your anxiety in general. And I said, well, not still pretty high, like, maybe an 8. And he said, no. We're going to put you at a 4. We're going to put you at a 4. You're at a 4. And I remember thinking, but I'm not at a 4. I'm really anxious. I can feel it. I was sat there and my palms were sweating and my stomach was going and all of these what ifs were flooding in. And he was going, no, you're at a 4. We're going to put, I remember him just every answer I gave, a 7 or an 8. No, you're at a 3 on that one. Okay. Yeah, no, I'm at a 3. What about this one? 9. No, we'll put you at a 2. And actually, Charles, that was the session. That was the moment where I went, this is bullshit. This is all bullshit. And I remember we finished the session and I probably had a panic attack. And I remember sending an email and I remember saying to him, I'm done. I won't see you for the 6th session. And I remember making an excuse and saying, oh, actually, I've got to take my dog to the vet for our next session. And actually, I found the email last week. I was digging through and I found it. So I could talk about it, and I think I said something like, "Oh, I've actually started therapy with BetterHelp," which kind of out of the frying pan into the fire. But at that time, it was like, "No, I've found something else. Bye, thanks very much." And there was no sort of. The email was just a very generic. Thanks for letting us know. All the best. Take care. There was no sort of. Let's really check it. Why have you cancelled the session? Do we need to do? How do they know that I hadn't put me into a suicidal state or something like that? Or that and it was just this kind of typical discharge letter. Yeah. And even then, I was just like, oh, fuck you, basically. How dare you? How dare you treat me like that? That's unbelievable. Yeah.
But you see, you just became a different face the following week because they're stacked up with referrals that are waiting to come through this perceived waiting list. We haven't got anybody available for 16 weeks. No, you have. You just don't want to show them for 16 weeks. There's a whole kind of it's like when Apple launches a product. They make people queue outside the shops for hours and hours and hours to give the impression that there's scarcity. And it's the same with this. They do the exact same thing. They say, well, you've got to wait 16 weeks for your first session. And the truth is they want you to drop out before the first session because then you're a cured statistic. Or they want you to feel substantially better before you go there so that the little difference they might make looks more substantial. And then they falsify data when you get there. I mean, it's just mind-blowing. As you know, I've sat in front of many people over the years, whether it's been at the retreats or workshops or whether it's been through the webinars or private, in private sessions. But without exception, what you're explaining is the exact same case in every single case that I've worked with. There's never an exception. Yep. It's mind-blowing. Like you go back to what you said about the panic attack thing, It's all very well for them to sit there holier than thou talking about inducing panic attacks in people. But I can tell you one thing for sure, Sam. Not one of them would be able to tell you what a panic attack is.
No, exactly.
This has always been my... but genuinely, they'll say, oh, it's when your heart races and you feel a bit sweaty and, you might sway around and feel breathless. That's a symptom list. That isn't what a panic attack is. That's like saying that an asthma attack is feeling short of breath. It isn't. That isn't what it is. It's something very deeply physiological that is associated with very ingrained intersystemic changes, namely in the systems that control your cardiovascular and respiratory systems, but also in the endocrine system, in the systems that control your allergy responses. And so it is a whole thing that's happening beneath the surface. So to describe it so superficially and to tell somebody that they can induce one when they don't even know what one is, and I can qualify this. I was called down to London once. I won't say to what organisation, but let's say it's the top brass, if you like, within health and well-being in the UK. They have this building, the Mecca of, And I was called down by 6 psychologists and psychiatrists and doctors. And I thought I was going down there to have a really nice conversation with them about what I did. What I didn't know was I was being taken there to basically be put up against a wall and fired at. It felt like an assassination. It was horrific. So at the end of this assassination, which I dealt with, very well, even though I say so myself, answered all their questions. Look, do I have all the jargon? No. Do I want it? No. It's blur. It's just bump. Yeah. It's just,
It's background noise, isn't it?
It is, totally. It's all
smoke and mirrors.
Yeah. And as many acronyms as they can produce, as many different names for as many different symptoms that they can think of, they just blurt out this nonsense to bamboozle people. And anyway, at the end of it all, they all went a bit quiet. So I said, look, I've got a question for you guys. I said, presumably you all work in, every day in mental health. Yes. Where do you work? Well, in hospitals. We've got practices in Harley Street, and and I said, I think there were 6 of them. So you must have 120, 130 years of combined experience. Yeah. And they sort of started to soften a bit. And I said, well, I've got a question for all of you then. What's a panic attack? And there's this combined kind of thing, And I said, no, I'm serious. What is a panic attack? And they kind of looked at me as if to say, are you serious? Is this a serious question? And I said, no, I'm not joking. I would love to hear what your views are on what's a panic attack, because obviously it's the most asked question, really. Most people fear panic attacks more than anything else because they feel like they're dying. So, if you're sat in front of a patient, you're one of your patients, and they say, so why am I suffering? What is a panic attack? You must have a really good answer for them. And they're all there like, shit. And I said, anybody? And there's this one woman that seemed to have taken the lead, and she said, well, it's when you go into anxiety and your heart races, and you... And she got about 10 into the list of symptoms. And I said, okay, so that's the symptom list. I said, but it doesn't answer my question. Well, what do you mean?
What is it?
I said, so what is a panic attack? That's all I'm asking. Well, it's and at that point, you see, they started to realise that actually all they ever did was reel off how it feels to have a panic attack. They didn't actually understand the psychophysiology of the panic attack, nor were they interested in understanding it, really. They didn't say to me, well, Charles, explain it to me. They just all went silent. And I said, look, the difference is I know what a panic attack is, and I can tell anybody who has a panic attack why they're having it, where it's created in the body, why it's needed, why it's necessary. And this woman said, it's not necessary, it's a panic attack. I said, but it has a function. No, it doesn't. It's when adrenaline just you're overwhelmed with adrenaline. It spews out, And I said that's not at all what it is. It has a function, just like a fart has a function, to expel gas from your digestive tract because it shouldn't be in there. Just like a belch or like a sneeze. It has a function. It isn't just some arbitrary response that is supposed to entertain everybody. It's there for. And they didn't get it. And if it helps, I can explain what a panic attack is, but I don't know whether it'll help at this point. But, the thing is, a panic attack is exactly that. It is something that developed to expel excess adrenaline that isn't necessary for fight or flight. So if you're in the throes of... So people that are in the throes of fear response because they've got to fight somebody or run or deal with real threat, they don't need a panic attack because they're using up the adrenaline. Somebody who's got an anxiety condition will often be watching Coronation Street and they can become overwhelmed with a surge of adrenaline because they've got fear disorder. Where's that adrenaline going to go if not into a panic attack? You could get up and run, you could get up and punch a boxing bag, or you could do some press-ups. That will equally use the body in a way that would use up that excess adrenaline. But it requires physical response. So in the absence of real physical response, the body produces physical response by making your heart rate race, by making your lungs pump, making your muscles tense and untense. So you're mimicking the fight or flight part in order to use up the excess adrenaline to purge your body and your bloodstream of adrenaline. That's all a panic attack is. But none of them could tell me. And to this day, even at retreats when we've had people coming for their anxiety who are trained psychologists, counsellors, psychotherapists, they don't know. So if they don't understand that fundamental fact, why the bloody hell are they helping people with anxiety? What gives them the right? They don't have a clue what it is they're suffering from. And you talk to any GP, they get an afternoon of training in mental health, pretty much. I'm being extreme with that, but in their 3 years at university, then their expansion into working practice, they don't get training in mental health. They just get told what to prescribe somebody if they appear in their surgery with OCD or panic disorder. It's like, well, you reach for this and give them this, and off they go. That's it.
Yeah.
It's disgusting. It's awful. But to think that me and you understand the psychophysiology of these conditions and can describe those manifestations in a way that nobody within healthcare or mental health care can is a disgrace. It's a complete disgrace.
Well, I think that's the joke, isn't it? We should have said as well. I'm an actor. That is my profession, but I'm also an anxiety recovery coach, and I think that's kind of the joke, isn't it? That actually a lot of these therapists, in fact, probably nearly all of them, haven't suffered anxiety themselves. So how the hell can they be? So, when you were saying about this woman was, oh, well, I know what it is. It's this symptom and it's this symptom and da-da-da-da-da. It's like, well, you don't even know what those symptoms feel like. You're talking about these symptoms and you're saying them so flippantly, like, oh, well, it's like that and it's that. And it's like, actually, it's a really devastating... at the time when you're suffering from it, and if you don't know, and obviously when you are suffering from it at the time and you don't know what it is, it feels like you're dying, because you think, oh my God, and I've had it before I've gone on stage, before I recovered, years and years ago. I remember being in my dressing room, it was a double show day, and I remember we'd done a matinee and I was sort of chilling out in the dressing room, and I just suddenly felt like this, I don't know what it was. It was just suddenly like, oh my God, I feel really lightheaded. And I thought, but I've just eaten, so I can't be, my blood sugar is, and I've always been very much into sort of health and nutrition. So I was like, well, I've eaten good, appropriate food for what I need. I've fueled myself properly and I've eaten good stuff. And so it's not like I've just eaten a load of chocolate and stuff. So why am I feeling like I've just consumed a chocolate bar? Why am I all jittery, and why? And I didn't know what it was. And actually, but and I panicked, and I was getting close to saying to my company manager, I can't go on tonight. You're going to have to get the understudy on. I can't remember why, but I said, no, I'll be all right. And sure enough, you walk on stage and 2 minutes later, that's gone. It's gone. And you go, oh, I'm fine. And it's, it's kind of...
I've been there.
Says it all, doesn't it?
Yeah.
But it does feel like the end of the world at the time.
Totally. And the scary thing is that even if you had somebody there that would be deemed a professional, they couldn't have told you what was going on, and that's dreadful. I mean, over the years, and as you're finding out now, through being a recovery coach, what you have to do is answer any question without pause. It's vital.
Yes.
You lose people. If you've got a 12-year-old in front of you that is experiencing panic or OCD or an eating disorder or health anxiety, and they say to you, I've got this strange feeling here, what do you think it is? If you go, you've lost them immediately, and that's all you get from these people, these so-called professionals. You get, I'm going to have to refer that on, or I'm going to have to, have to think about that one. But, if you're an anxiety sufferer and you've got health anxiety and you genuinely believe that you're dying of something, and somebody says to you, I've got this symptom and I don't think it's anxiety, what do you think it is? You have to be able to say, look, that is something that I experienced or other people have experienced. That is something that is, not necessarily linked to any kind of clinical illness, and it's something that I've heard before. Because if you can't reassure them in the first instance, or at least have the bedside manner to work around it so that they don't feel more scared by your response, then you shouldn't be sat there. That's the truth. It's got to be that way. But, so often I went to the doctors and I said, I ended up actually with a really good doctor. Claire was just amazing. Sadly, she's no longer with us, unfortunately. She succumbed to quite a long illness, and it was horrific. But she was a lovely lady. But she was a junior doctor when I met her, and she'd had anxiety, so she was able to talk about it openly.
Yeah, she understood it.
Yeah, she understood it completely. And the thing was, when I said to her, when I was anxious, if I went to her and I said, look, I've got this this spot appeared on my, on my back, or this, I've got this patch of, she knew not to say, okay, we better get that biopsied. But that was her intention, but she never put it like that. It was, oh, let's have a look. Yeah, that looks all right. So I'm just going to scratch it off a bit, and I'll just check. But I think it's absolutely fine. And it was the change in her manner. It was, but now I went with my wife to the doctors quite recently with something on her leg, and the bloke was like, no, I think we better get that seen too. And she said, oh, what do you think it is? Well, I don't know. And you lose them. What you don't want to do is give them a false impression, but what you need to do is be mindful of what they're experiencing and respond appropriately, which is what we've all learned to do over the years, helping all the people we've helped. It's vital, and not only that, you have to know your shit, at the end of the day.
Totally.
And because as far as anxiety is concerned, I don't think there's anything anybody could ask me that I don't know, because
no.
Decades of listening, learning and understanding.
Totally. Yeah.
And then I have psychologists and psychiatrists turn around and say, who do you think you are? You haven't got a qualification to your name. And you've got some 22-year-old who's just left university and got a degree in psychology and is now a clinical psychologist, and they haven't got the first clue of what they're talking about. And I've come across them, believe me. And they sit there, with their snotty attitude saying, who do you think you are? Well, I'm a 58-year-old that suffered for 22 years and has spent the last 30 years developing and programs of recovery, researching and developing that actually work. That's who I am, so it's unbelievable, Sam. It really is.
I mean, so when I was suffering, my biggest sort of symptom or manifestation of the anxiety was horrendous IBS, terrible digestive issues, to the point where, I believed that I had some sort, bowel cancer or stomach cancer or something, and I went through all and again, this was during COVID. And right at the beginning, it's sort of 2020. So, the hospitals were absolutely, the NHS was completely rammed. And so I went through all these various tests. I went to the GP and they basically said to me, look, we can put you through the NHS to do all of these various, bowel transit tests and CAT scans and MRIs, and we can test for, whatever disease. I've been tested for every disease under the sun, name any disease or illness or virus. I've been tested for it. And they said, look, we can do it through the NHS, but you're going to be on a very, very, very long wait list. And actually, they're not doing some of those tests because of the risk of COVID and all of this sort of stuff. So, your other option is to go private. And at that time, when I was suffering, it was like, right, well, I'm going to go private, because I was terrified. God, what if I've got this? What if I've got a horrendous cancer, or what if I've got this terrible thing? And so I went private, and my family probably spent upwards of $3,000 on medical tests, MRI scans, bowel transit tests, all of these various things. And of course, all of them came back complete, perfect bill of health. No, we can't find any medical problem with you. What they did find was, elevated ALT numbers with my liver and low white blood cell counts. Obviously, they did a load of tests for that. And they were like, oh, well, you could have non-alcoholic, because I wasn't drinking at the time either. I'd given up alcohol. And, you could have non-alcoholic fatty liver disease. And I was kind of like, you've seen me. Like, I've sat in your office. I'm not the candidate for someone with non-alcoholic fatty liver disease. That's absolutely insane. I live a very active life and, blah, 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 blah. And they said, yeah, no, we'll test it. We need to test for liver scarring and all of this. And, of course, again, it all came back, complete bill of health, clean bill of health. And actually, after the fact, after I'd done the method and I'd, recovered, they wanted, I went back for a blood test to check in, and everything was completely back to normal. All of my levels were back to normal, and they were sort of going, "Wow, God, we can't understand why it would have been like that." And they can't. So even then, they were like, "We can't understand. And I was sat there thinking, "Well, I can. I can understand why. It's because my body was in a constant state of fight or flight, constant.
Of course.
And so of course, I had these horrific digestive issues, and of course the various numbers in my body were all over the place because my body was in so much stress.
totally.
So much stress. And I remember even saying to them at the time, I said, could this be related to anxiety and stress? No. We don't think it could be related to that. No, absolutely not. Here you go. Oh, by the way, here's a bill for £1,000 to do this test. And Incredible. You just sort of think, wow. And actually, like I said, the moment that, I recovered and I felt better and I went back for a routine, for a blood test, and they were like, oh yeah, no, everything's completely clear. And obviously all of those various tests were just completely clear. And it was just like, wow. And it's, it's fascinating as well, because the moment that I knew that I didn't have, bowel cancer or stomach cancer or any of these other, and I tested for HIV, AIDS, herpes, all of these, every STI, every bacterial disease, everything. The minute that I discovered, I don't have any of those things, complete bit of health, it's amazing how a lot of that discomfort and pain started to just melt away. Yeah. And it's, because all of a sudden it was, I've learned that I'm safe, and there you go. And it's just amazing, the power of that, isn't it? The power of reassurance, of reassurance and knowledge, and actual solid, can't be debated knowledge. Knowledge is knowledge. Once
Absolutely
you know
right.
something, you can't unknow it, and it's amazing how, and like
facts
how
facts.
Facts are facts. Yeah, exactly. and it,
I say this to people, and they go, "Well, they're not always. It's a matter of opinion." I go, "No. If you're talking about opinion, it's not a fact. An opinion is the voyage towards facts."
That's it.
Yeah.
But it's amazing how and people will always put a spin and go, yeah, but the brain is a very complex system, Sam. It's all very complex, and you think, well, yeah, but
it really isn't.
It's really not, and it might be complex in its formation, but it's not complex in how we perceive it. It's actually quite straightforward.
It really is. It absolutely
it's working for. It's meant to be, because it has to work for us. If it was this super complex thing, none of us would be alive. We'd all have to. So it's crazy, isn't it? It's really quite.
It is crazy,
unbelievable.
And behind all of that, what you've just said is the fact that anxiety isn't just. It's one thing. It is one thing. It's disordered fear. But behind that disordered fear is a sophisticated intersystemic, because just because it's endocrine in nature and not emotional in nature doesn't mean that it's can be dealt with by endocrinologists. The thing with anxiety, I was going to say,
and should we say what should we say, just for people who might not know what the endocrine system is, what that actually is?
The endocrine system is pretty much, in simplistic terms, in layman's terms, it's the system that controls all of your hormonal output, so your sort of chemical output and your production of chemicals. So it's all of those things where things are secreted from, let's say.
Yes.
So it's the glands. So when you have, I get a lot of women come to me and say, look, I'm 55, I'm perimenopausal or I'm menopausal, and I'm suffering from anxiety. Do you think it's the menopause or the anxiety? And the first question is, well, what came first? Oh, well, I've always been anxious. Well, there you go. That's it. Yes, the menopause could be exacerbating the problem, because it by definition is an endocrine issue. That's why you go and have HRT, because it's replacing the hormones. Similarly with diabetes, it is an endocrine condition. You're not producing enough insulin. Your pancreas isn't doing what it should, so you replace the natural production of insulin with injections or diet modification. You're externally or sometimes internally with medication manipulating the endocrine system to be normal in effect. And so when you've got if you've got anxiety and you go out and get absolutely paralytic, what you're doing is you're poisoning your body, then your endocrine system and all of the systems are trying to get you back to normality. So it's no surprise then you wake up on Monday morning with anxiety, because you're working against the natural recovery process and you're just exacerbating the condition. But if you spoke to a psychologist or psychiatrist, they might even suggest that you have some alcohol to try and steady your nerves.
Smoke a cigarette or
or a spliff.
That's
been suggested to me. Well, I think cannabis works really well. Does it really? Most of the young people I know that come to with anxiety, a lot of them experience their first anxiety after they've smoked their first weed. So how does that work? But again, I know why that happens. I understand the physiology of it. I understand the endocrinology of it. So I'm able to sit there and say with confidence, this is what's happened to you, and stop worrying because we can get this sorted. But in psychology, it would be, now, this is a long-term problem. You've really activated something very powerful and probably that will stay with you for life. And we need to medicate it, and we need to talk about it, and we need to look at why you smoked the spliff in the first place, because obviously you felt the necessity to take drugs. I mean, they'll say and do anything to lead you down some kind of treatment pathway. And similarly, with what you had, when you're in intersystemic disorder, which is what anxiety is, your digestive tract isn't going to be performing perfectly because in fear response, it's very, very, very highly affected by fear response. The mechanism itself shuts down pretty much the digestive tract during fear response. Why? Because it's resource hungry, because it's full of water. And all of those resources and all of that energy that goes into the muscular sort of systolic movements of the bowel, and all of that shuts down because all of those resources are needed in your muscles so you can run faster or fight. And it stands to reason that it's going to become sluggish and you're going to get distension and you're going to get wind or you're going to get diarrhea or you're going to get, it stands to reason. But a doctor wouldn't tell somebody with anxiety that. They'll say what they said to you. Oh, no, we don't think it's associated. This is IBS. This is something completely separate that needs separate treatment. And at the times I've heard that, tens of thousands of times, it just ain't true. Just ain't true, and it's frustrating.
No, and again, I was another anecdote for you. I was put on to a nutritionist or a dietitian, which I later found out was a naturopath, and I have very strong opinions about naturopaths. Yeah, and
we'll discuss that another time when we've got 4 or 5 hours.
Absolutely, exactly. And I was put onto her to sort of deal with the let's say the aftermath of the bowel problems and all of that sort of stuff. What again, probably my own ignorance to all of this. That knowing what I know now, I look back, I think, my God. I remember she asked me. And this was online because it was still COVID times. And I remember she said to me, right, I need you to send me samples of your hair samples and nail clippings. And that's how I'm going to test whether you have any intolerances or allergies or sensitivities. And, of course, I, clipped my hair off and, sent it off. And she came back and she got, right, I've got this report. Got the report and it turns out you're sensitive to this. I listed off all these things and your digestive enzymes are way out of whack, so I'm going to have to prescribe all of these supplements and vitamins, and you're going to have to take all of these digestive enzymes before you eat any meal. You're going to have to take this, and you're going to have to take Similase before you eat this, and you need to make this because we need to adjust your fat absorption and your protein absorption. And it was like, oh, okay, and meanwhile I'm like, Christ, how much are these? 30 quid for a little pot of 10 pills that are going to last you 5 days. Okay, yeah, well, it's what I need. So, I did it, took these pills, and maybe, and you think, oh, well, probably a bit of placebo effect. You suddenly go, oh, well, if this is keeping me safe, but then, I ran out of those pills, and it didn't really change anything, and then obviously, years on, researching into that. How the hell can you test how can you get any information about what's going on inside your body from a hair clipping and a nail clipping where you think that piece of hair here, that's been dead for that's just a dead piece of whatever flapping outside your body for months. How the hell is it going to tell you an up-to-date report of whether I'm have a sensitivity to almonds? And weirdly, the first time I did it, she said, "Oh, turns out you've got a sensitivity to almonds." Oh, right. Well, I've been eating almonds and drinking almond milk for years and years. Right. Well, yeah, no, stop that because that might be one of the causes. Okay, I'll stop it. Oh, it hasn't changed anything. That's weird. And then I remember, I'd stopped it and I did another test. She wanted, right, we need an updated test. And a month later, I sent off my clippings and oh, you're no longer sensitive to almonds. You can start eating those again. And I was like, oh, just think, at the time I'm like, oh, fantastic. But now I look back and I think, oh my God, like it's unbelievable. And you trust these people because they have letters after their name, or they have a very well put together website, and they've got client testimonials, and they have lovely images and videos, and they have all this stuff, and you think, wow, they must know what they're doing. How incredible. They don't know shit.
No. It's unbelievable.
They don't know a thing. It's pseudoscience, and it's all lunacy.
Yeah, I mean, I think what they do is they take, for example, the hair thing. There is a scientific truth that hair can tell you some things. There's a scientific truth that your fingernails can, that your skin can, that there's a scientific truth in there somewhere. But the problem is they take it to the nth degree and say, well, your hair clipping can tell you everything about, every aspect of your past and your genetics and your sensitivities. It just ain't true. And when you speak to, immunologists, and I went to see an immunologist once. This will make you laugh. And the guy, he didn't fill me with. Let's just say I went to see him, and he didn't fill me with confidence. And I won't say too much about his office, but there was a line of takeaway food trays, crumpled, like the aluminium ones that you get the paper top on.
Yeah, like in a Chinese or an Indian. Yeah.
There was a line of those on his desk in front of me, and he went out of the room, and I nudged Beth and went, look at that. And inside were a line of syringes with the caps on, with needles on, but And I looked at them. I thought, I hope he doesn't think he's putting one of those in me. And she laughed. Anyway, he came back, and he was talking to me about how he's going to put something like 30 injections into me to see how I responded to the allergens in these injections. And I looked at Beth and looked at these injections on the table. I said, well, are those them? And he said, well, those are some of them. And I thought, hold on, this doesn't feel very sterile to me. He's prepared these before I've even arrived, and they're in food containers, crumpled up as if they'd been reused. And he said, are you not comfortable with injections? I said, well, put it this way, I don't think I've ever had one. He said, what? I said, no, I don't think I've ever. He said, well, you must have had a blood test. I said, no, I don't think I have. And he said, which is genuine, by the way.
Yeah.
And he said, well, they don't hurt. And at that, he picked up this syringe and stabbed it through his jacket into his arm and said, see, it doesn't hurt, it's fine. And then pulled it out, put the cap back on and put it in the thing. So anyway, at that point, like my heart was going 10 to the dozen. I was thinking, no, this ain't going to freaking happen.
Absolutely.
And I turned to Beth to look at her, and she looked at me as if to say, Christ, where are we? Anyway, he left the room again presumably to go and get his next batch of loaded takeaway food containers.
Absolutely,
and I saw this certificate behind his desk. Yeah, exactly. Yeah, that's what he would have needed with me. Believe me. I wasn't going near. So I went. He got it, and I saw this certificate on the wall, and I could read the name of the university. I won't say which one, because it kind of. Well, yeah, I won't say which one. It was an international university, and I got up and walked around the desk to have a look at it, and it said university name, the degree course, and then a signature, and below it, in very faint pink text in capitals, it said failed. It said failed. No, honestly. And I turned round to Beth and I said, we're gone. Come on, out. So we got up and walked out into the hallway, at which point his family walked in, and he came from the back of the house. He said, oh, are you going? I said, yes, I am. He said, why? I said, I don't need to give an explanation. I'm going. And we drove all the way back from Manchester, which was about an hour and a half. And I was in bits. I was shaking. It's horrific. But it just shows you that you do latch onto anything.
Yeah.
I've been to, like you say, naturopaths, dietitians, nutritionists, and there's a vast difference between those two things clinically, and people don't understand that. And I've been to alternative therapies, and I've been to faith healers, because you grasp onto anything. Because you're so desperate for some relief.
You're desperate,
desperate, and this is how people find themselves, and it's unnecessary, and it's just not, it's not conducive to anybody's, to reassurance, which obviously is going to lower your anxiety. It doesn't reassure you. What it does is it makes you realise that actually everything's going to fail. But the problem is you lose sight of the fact that something will work, something can work. It's just you haven't yet been introduced to it. But by the time you get to us, for example, and I believe that we are the only providers of true recovery, and that the therapeutic approach is real and works and can't fail, in fact. But by the time people come to us, they're very disillusioned, if not terrified. And often they don't find us because they don't want to go back outside of their home, the safety of their home, to find a solution, because they've been let down by absolutely everything they've paid for, or and it's a disgrace. But over the coming weeks, months, years that we run this podcast, I want to address all of that, and I want people to come and genuinely ask the questions, and for us to debate this openly.
Yeah,
because
totally.
when I've asked my accusers for an open debate, they won't have one. They say, you're a fraud, you're a charlatan, how dare you, you haven't even got an associated qualification. And I say, yeah, but how many qualifications do you need when you've spent 22 years suffering, and 30 years helping people to recover, and you've never seen it fail? How many qualifications like yours do I need? Show me your testimonials,
Yes, exactly. And really that is the only qualification you truly need is, you've been a sufferer. Yeah. You know what it feels like when you're sat in your house and you feel like that everything around you is a threat. That is the biggest qualification of all.
And then top of that, Sam, if you can then sit in front of endocrinologists, psychologists, therapists, psychiatrists, gastroenterologists, every ist that you can and I have, and they throw things at you that you counter correctly, albeit I haven't been to medical school, but I do understand the human body, and they have no issue with anything I say to them, you're in the right place. If you that's where we're at. That's where we're, as an organisation, that's where we're at. Indisputably, we provide the solution, and if people want the solution, come to us. If they don't, fine. If they believe the bullshit that they read online about, Charles Linden, that bold idiot, he's this, that, and the other, that's fine. But that ain't 650,000 people talking. That's a handful of idiots.
Exactly, and it's you can there's safety in numbers, really, isn't there? If you've got that many people saying, you must be doing something right. I think that's the ultimate.
It totally is. It is, and ultimately, you pick anybody out of psychiatry or psychology or any of those practices, and find the evidence of success for them that we have. You won't find it. But the difference is, as a sufferer, you don't ask them to see the. It's like going for an operation. Or could I study all of your past patients' histories, please? Could I look at their notes and make sure that I'm choosing the right surgeon? Because if I'm not, you don't do it. You just trust that this person has the ability to cure you and to operate on you successfully, and that it's all going to be fine. You just trust them because of their name, because of their reputation, because they work within the NHS. But you don't ask a psychologist for their credentials. And let me tell you, Sam, I mean, you'll know this, but most psychologists and counsellors and psychotherapists go into that business because they suffer themselves. Not because they suffered and recovered, but because they suffer. I speak to people all the time that are counselling psychotherapists, psychologists, psychiatrists. Oh, how did you get into it? Oh, I got into it because my daughter had anorexia. Oh, right, and how is she now? Well, and you go, well, you can't cure your own daughter. It's like, well, if you can't, why are you trying to cure other people? Yeah. It's a disgrace. It's blind leading the blind. There's an organisation for people that suffer from anorexia and bulimia and eating disorders, and it's run by a woman who is pitched as one of the world authorities on eating disorders. Both her daughters still suffer. One of the biggest charities in the UK that deals with a particular type of anxiety condition, I won't tell you which because it would identify it, is run by a bloke with that condition. And all of his people that work within the organisation have that condition. So what are they going to do for people with that condition? Just moan about how they feel? How can they offer any support, guidance or recovery?
Perpetuate it. Yeah.
It's shocking. It's
unbelievable.
But they're acceptable. They're acceptable. The club for suffering is acceptable. The club for recovering, not so much.
No.
How can that be? It blows my mind. It really does.
It's unbelievable. So, Charles, let's briefly talk. What's making this? What's changed, and what's making this current generation and current society? Why is everyone so anxious? What's going on? What's changed?
Well, the thing was, humans were on a nice evolutionary trajectory until somebody came along and decided that technology was the way to go. Really, I think technology has been the biggest influencer in the field of all the mental health world.
Social media, isn't it?
Yeah, social media and the static pursuit of gaming, the constant incoming data stream that is just bombarding people with high level sensory data, that when they stop receiving that data creates a sense of starvation in effect.
Yes.
And it's an addiction. It's an addiction in its truest nature.
Well, it's like creating chronic boredom, isn't it? It's turning boredom into a chronic problem.
Absolutely right. Kids don't know how to be bored now. Young people don't know how to be bored. We knew how to be bored, and we also knew how to make our own entertainment. I mean, I know I'm substantially older than you, but
No, but I did as well. You'd go out, you'd build a den, or you'd build a tree house, or you'd go out on your bike, and
totally.
you'd be out from 9 o'clock in the morning, and if you'd come back when dinner was ready and dinner was on the table, 6 o'clock in the evening,
yeah,
and you'd be out the whole day. Hungry. And only because you were hungry, and then you'd wolf your dinner down, and you'd be straight back out the door
if you were allowed.
And that'll be it.
Right. Yeah, totally. And I think you've hit the nail on the head with that. The problem is that society has changed, and there's a sense now because of anxiety that there are threats out there. Don't get me wrong, but there is increased threat out there, but it's not on a scale that is so substantial that it should stop people from leading normal lives. But I think supplying kids with phones was a massive turning point. I think when I was a kid, we had 3 channels on the TV at best. The introduction of Channel 4 was a real treat, and then the introduction of satellite TV and MTV
and then Sky and all of this stuff, and
but it's that escalation. So I think what was happening is that social and physical evolution were pretty well matched, through the wars, let's say, into the 50s, 60s, and 70s, and then what happened was that social evolution took an upturn because of the availability of mass data and music and visual data, and the brain and body just didn't catch up, and so you're going along like a steam train in life, and the evolution of a fear response didn't have time to adjust. And then, of course, on top of that, you've got all of the issues. I mean, COVID was a big turning point of late because of all those people that were kind of waiting in the wings, let's say, to develop an anxiety condition. So those people that were predisposed to anxiety, which was an ever-increasing number anyway, were suddenly treated to this media catastrophizing that activated anxiety on a grand scale. And suddenly, you've got kids of 4 and 5 that had got eating disorders, some that were self-harming, having panic attacks. And it just, and now you've got the bottleneck, the inevitable bottleneck in mental health services that was always there, but now just can't cope with the numbers, and so kids are being neglected. Well, these kids that were 6 or 7 then are now 11 and 12, and they're manifesting things that anxiety creates. They're manifesting in puro and OCD. They're manifesting ideas around their sexuality and their gender. They're manifesting ideas around their very place in the world and whether they believe in a god. And there are a whole load of things going on in these small minds that nobody's explaining to them, and it's catastrophic.
Yeah.
But again, we'll talk about this in coming weeks, and we'll focus in on specific topics.
Totally.
Totally. With a view to get going really deeply into what they're really about, and hopefully inspiring people to come to us and get some real help.
Absolutely. And I hope this has been a nice introduction to people to realise that actually recovery is. I've said to people that I've helped, recovery is not only is it possible, but it's it's inevitable.
It is.
And it's and it will happen. It will be.
Your brain and body
successful.
is just being told just be waiting to be told what to do, and that's it. It's one process. It's like eating to cure hunger. It's one thing, but if and you have to get the thing right, but it's not hard.
No, well, like we said at the beginning, isn't it? We already know what it is. It's just about, like you said, just leading the horse to water.
Totally, absolutely right. Yeah, and like I say, that's what really drove Sam and I to create this podcast, because nobody else is saying the necessary things. Every day I turn on talk radio or the BBC, and I hear something that just makes me, put my head in my hands and hope that the message gets out there, because it's desperate.
Totally. Well, and we've talked, Charles, haven't we, about my industry, the performing industry, which is sadly riddled with people who are suffering from anxiety, and surprise, surprise, all these people with incredibly high creative intellects, and of course, and that it's an industry that is incredibly in many cases unviable and fickle, and so it's the perfect, it's a petri dish. It is for anxiety. It's a breeding ground.
It really
and
is.
Actually, and the methods of dealing with it, of dealing with the anxiety, which currently in that industry, it's just not up to scratch. It's not doing anything. It's not actually helping people. It's giving people coping mechanisms, and it's giving people, and everything that we've discussed today. It's telling people, oh well, this is who you are, and you've got to make peace with it, and you've got to take these pills and do this therapy. But it's not actually getting rid of it. But it's frustrating, because I go into rehearsals with people, and you meet people all the time. Oh yeah, I suffer from anxiety, and obviously I hear them say that, and it comes up in conversation, and I say, oh, actually I recovered, and they're so curious to know how and why, and what did you do, and you try and sort of tell them, and you can see them kind of, again, that becomes risk assessment, doesn't it? You can see them risk assessing what I'm saying, and it's so frustrating because, and it's difficult, isn't it? Because you want to grab hold of them and go, right, come with me, sit there and do this method, but you can't do that, because that's its detriment, isn't it? It is, yeah. But I mean, the good news is that and over the years, obviously this has been a long time coming, because over the last 30 years, I've been involved with schools, I've been involved with actors, as we've had these discussions with sports people. The thing is that this doesn't just strike the young; it can strike at any age. And what I've discovered over the years is that clearly the most important thing is to focus on prevention. It always is. Preventing something from activating in the first place is vital. So, but what I've had the ability to do, and especially during lockdown, because we had a lot more ability to be more flexible in the way we worked, so I could really concentrate on the development of things. I developed a tool called, at the time I called DPT, which stood for Detection, Prevention and Treatment. And it's a tool that actually diagnoses predisposition. So in other words, it'll take anybody of any age and say, what are the chances, the statistical chances, the percentage chance that this person could ever develop an anxiety condition? Because not all people can. And if you can get to the point where you know that this person has that predisposition, that you can then use prevention. And we know how to do prevention. If you've missed that opportunity and somebody's already suffering, we then have recovery. But that's what treatment should really look like. It should be built into every school syllabus. It should be available to every sports person, everybody working in the armed forces, the emergency services, in clinical health, in mental health. These tools should be with them, because they are the tools for recovery. Whether or not they want to use them for financial reasons or other reasons is entirely up to them, more for them. But our intention, you and I and our team, is to get this stuff to everybody, because not doing so is unacceptable when you have it to hand. And potentially detrimental.
Totally detrimental. But I mean, let's look forward to producing some really good content for people, and making sure that people do get the reassurance they need, and then move on to get the help that they need. Because it's vital. Absolutely. It's not just vital to them, it's vital to their families, it's vital to the businesses they work within, it's vital to education, but more importantly, it's vital to their community and the world, because the knock-on effect of this is catastrophic.
that's the other thing, isn't it? It's, you know, it's the people who suffer in the wings, you know, the people, you know, it's bad. It's obviously awful for the person suffering with anxiety, but I think for the friends and for the families and for the loved ones who have to sit back and watch it and see someone that they love suffer, it's unbelievable. And I remember my folks saying to me, you know, I remember my dad turning up at my door one day, and I was in a horrendous way, and he just and I, you know, I'd gone through all these tests and I was waiting on all the results, and he knocked on the door, and I opened the door, and I think I just burst into tears, and I said, I don't know if I'm dying or not, Dad. And he just grabbed hold of me, and he was crying, and it was just this awful thing. And I look back on that, and I just think, you know, I look back on it with anger, because, you know, I was being facilitated to feel that way. You know, I could have very easily not felt that and not had to go through that horrendous period in my life. And I look back on that, and, you know, you look back and you go, well, you know, you can't change that happened, and it's, you know, frustrating, and it's anger inducing. And I think this is why I've always been really, you know, ever since I recovered, I wanted to become a coach, and I really wanted to do whatever I could to work with you, Charles, and with the method, and to try and get it out to as many people as possible, because, you know, we know how it feels, not just to be a sufferer, but we now, you know, I can now understand what it feels like to see someone suffering, and to go through that, and to, you know, and to be able to sit down with my folks now and my family now and talk to them about that period in my life, you know, and to hear them sort of say, yeah, we were terrified, we were absolutely terrified, and we didn't know what, because again, they didn't know either. They didn't, you know, that for all intents and purposes, I could have been dying, you know, I could have had a horrendous disease.
Yeah.
That's what I was telling them.
There is a sense of hopelessness, isn't there? It's horrible.
Yeah, completely, and you know, completely, and again, when you don't have, when they're not getting the reassurance from these medical professionals either, when they haven't got a medical professional saying to them, you know, when the medical professionals say, well, we don't know what's wrong with him, we don't know what's wrong with your son, you know, he could have this, he could have that, you know, it's horrendous, and so it's really incredibly important to.
But we're going to take that away. I know that we have the power to take that away for people.
Absolutely,
and that's the important thing. You know, that sense of hopelessness, or the sense that there is no solution out there that people are often told. We can undermine and remove that for them, and that's where reassurance comes in. And with that reassurance comes a lowering of their fear, and with that, obviously, comes a lowering of their anxiety. And we will bring them the hope they need, and also the solution they need.
And the final thing to say on it is, you know, it's I was, you know, working with a client the other day, and I said, you know, weirdly, even though it was a horrendous time in my life, I try and frame it in a way that I go, actually, you know what, the process I went through to eradicate it, I try and view as it's enriched my life so much more now, and I try and frame it in that way, because I mean that's, you know, I try to be optimistic and positive about it, because actually, you know, a lot of the stuff that I do with my life now and the interests that I have in my life now, I may not have discovered about myself, I may not have done had I not been through that. So I try and look at it, you know, in a positive light, and I think that's. And I say that to people now as well. I say, you know, don't just do these things as a way of eradicating your anxiety. Do these things as a way of enriching your life. That's more important. Totally. Yeah. And actually, if you eradicate the anxiety as a result of that, then it's a 2-in-1. You're winning. Yeah. You're winning tenfold. And I think that's probably the best way of approaching it, isn't it?
It totally is. I often have clients say, you know, not only is it getting rid of my anxiety, but it is enhancing my life. It's just a good way to live. It can only lead to fulfillment. So it's a no-brainer. Totally. We'll Charles, get everybody there, Sam.
We will, and this has been great. I've really enjoyed this episode. It's been great to sort of finally sit down and do it, and We finally did it. We tried to do this last week, and we couldn't figure it out. But we had a nightmare with the software, but we've figured it out, and here we are. And I'm so glad, because it's brilliant. I've been really excited to crack on with this, and I know you have as well.
No, it is exciting. I'm really excited by it. I mean, it's fantastic to have such a great co-host, but we will be bringing other people in to join us as well. So it's going to be an exciting time, and I think the people that we bring in are going to be people that have been hand chosen because of the benefit that they'll bring to people. So, I just hope that more and more people catch on to this and understand what it is we're truly doing here,
Yeah,
because
absolutely.
It's our calling, so to speak.
Yeah, absolutely.
It's been my calling for 30 years. 30 years, can you imagine?
Amazing.
Crikey.
Absolutely amazing. Well, here we are.
Let's get on to the next episode, and let's make sure that the next one is even better than this one. Now we've got the technology beat.
Totally.
And onward and upward.
And what do we need? We probably need to tell people to subscribe, don't we? Subscribe and share and we're going to be available on.
You normally do with the podcast.
Yeah, and we're wherever you get your podcasts, Apple and Spotify and all of these places. So yeah, put it out there and share it out. And if you know someone who you think might need this, then please, tell them, because that's the whole point. We want to reach as many people as possible. But yeah, thank you, Charles.
Brilliant,
it's been great.
No, thank you. It has been fantastic.
There we go.
And we will continue on this next time.
Totally.
At some point we'll more specific, over the time.
Yeah, exactly. We're going to get more specific, and like you said, we're going to have more people on, and we're going to have a nice, opportunities for debates and discussions, and I think that'll be great.
Perfect.
Lovely. Thank you, Charles.
Thank you.
I'll see you next week.
We'll see you next time. Cheers.
Bye-bye.
Bye-bye.